What's up, Dr. Pierce? As you could tell, I'm not here tonight. Had a little situation I had to take care of. So I thought the next best idea would be for me to video this. That way at least I'm here in spirit with everybody. You guys aren't technically here, but I'm looking, give it the effect. My project for the bibliography, the topic I chose was aphasia. And the definitions that I came up with, I found three. Aphasia is an acquired language disorder in which there is an impairment of any language modality. This may include difficulty in producing or comprehending spoken or written language. It is also the inability to use or understand language, spoken or written, because of a brain lesion, or a partial or total loss of language skills due to brain damage, usually damage to the left parasylvian region, including Broca's area and Wernicke's area, causing aphasia. With my presentation, I put on the PowerPoint 3 of my articles, and the rest I'm just going to read that I have. The first one I found is the rate and extent of improvement with therapy from the different types of aphasia in the first year after the stroke. Participants in this article were 75% aphasic patients with the first ever stroke. The participants were screened after having stroke for the first time and were given tasks such as picture object selection, naming objects, describing or recognizing the association between items, facilitating the expression of feelings and opinions, and improving conversational skills. Patients were also encouraged to use gesture and other means of nonverbal communication, including a wide range of communication aids and equipment. The treatments given were different on the case-to-case basis and were started in a hospital and then given out as a patient in time. So when they first started, they all had them inpatient in the hospital, and after that, after a certain amount of time, they'd bring them along and they were expected to do it as an outpatient procedure with a caregiver to get it done. The results were the median percentage increase in the Western aphasia battery quotient was statistically higher in patients with Broca's aphasia than in the other groups at all weeks. Patients with Wernicke's aphasia had significantly greater median percentage increase in their aphasia quotient than those with conduction and anomic aphasia at weeks 12 and 24, but less than patients with global aphasia at week 24. Patients with Broca's aphasia appeared to have the best prognosis for improvement of language function in the first year of stroke, and the extent of the improvement in the patients with global aphasia is better than that of patients with Wernicke's aphasia. My next article is the impact of personal relevance and contextualization on word-picture matching by people with aphasia. To determine the effect of personal relevance and contextualization of images on the preferences and word-picture matching accuracy of people with severe aphasia. 8 adults with aphasia performed 2 experimental tasks to reveal their preferences and accuracy during word-picture matching. The researchers used 3 types of visual stimuli: personally relevant, contextualized photographs, non-personally relevant, contextualized photographs, and non-contextualized iconic images, paired with 3 types of target word labels of people or objects, actions, and socially relevant events as the stimulus materials. So in the example with the picture, the first one that he started off with is a picture of a lady opening presents, and they associated it with a baby shower. The second one, they have another woman opening presents, but they don't associate it with anything. They just say, this is a woman opening presents. The third, they come with just an iconic image of the actual thing being done. What they came to realize in this article was if you were to associate personal experiences with stuff, they were able to better understand the relevance of it, and they were able to get through things even though they had aphasia. So examples like this were the best target for any of the patients. In my third article, continued. While showing these pictures, they would associate the pictures in relevant and irrelevant situations that would challenge them to see which associated them best. And like I said, clinically the findings highlight the importance of using personally relevant contextualized photographs rather than the generic photographs to support the communication attempts of people with aphasia who cannot communicate effectively using natural speech alone. My third article is Bilingual Aphasia, the Theoretical and Clinical Review. It's a study to see the effects of aphasia on bilingual individuals and to test the difference. They would review the difference of review of the literature was conducted to summarize and synthesize previously published research in the area of bilingual aphasia, highlight unique aspects of aphasia recovery, assessment and treatment, and identify areas in need of future research. I like this one probably the best because they don't really show too much research in the bilingual aspect of aphasia. Anytime that we've learned it as a class or myself, it's always with the English language. So with this one, I got real interested in it, and I learned that the Latino group in the U.S., the stroke incidence is slightly higher at 1.63% compared to 1.36 for their non-Latino white peers. And transisic ischemic attacks at younger ages are also more frequent in this group. And there still remains a dire need for empirically validated management techniques, particularly in the terms of determining which language to target, identifying which aspects of various languages are most vulnerable to insult, as well as most responsive to treatment, and establishing how to exploit language similarities to maximize treatment efficiency. So in this one, basically, they're in the works of starting to get this going, but we're not sure how long. Are we on time? That's the end of that. The rest, I'm just going to go off what I read. The next one I have is a computerized communication aid in severe aphasia, an exploratory study. This one is for severe aphasia patients. They want to implement the TouchSpeak, or a TS. It's a computerized communication aid that aims directly at functional use in daily life. So basically you have a machine that they're connecting with a picture and the word associated that you want to communicate with. So with this, they're giving it to them, and they have it in two phases. Phase 1, they have 12 hours of training over 10 weeks, and in this phase, they did not introduce the handheld. They just had a simulator on a desktop with much bigger, that way they can understand the different items. They had it in 3 categories: food and drinks, at home and outdoors. That way they can understand every single part of what they want to do when they have to talk to somebody in an everyday process. The phase 2 was 12 hours of training over 12 weeks, and they were given a caregiver and a TS and were asked to go into situation and try to use them to communicate. On top of that, they were asked to set up role-playing situations so they could better understand the TS and how to use it. These studies lasted 3 years, and afterwards they interviewed the patients and gathered results. Patients with a severe aphasia are able to master their hierarchical computerized vocabulary, and it is used in specific communicative situations. And it also says that it may have generalized effect on the overall communicative ability. So basically, these TSs are helping revolutionize severe aphasia patients in a way so that they can actually communicate with their peers, with their family, or just in everyday situations. My next article was Psychological Distress After Stroke and Aphasia, the first 6 months. This is where they explored the factors that predicted psychological distress in the first 6 months post-stroke in a sample including people with aphasia, so not everybody had it. Distress was assessed with the General Health Questionnaire, and it was assessed to written information for people with aphasia. Other measures included NIH Stroke Scale, a Barthel Index, French A Aphasia Screening Test, French A Activities Index, the MOS Social Support Scale, and the Social Networking Indicators. What they did in this article is they said that they took a group of people with certain percentage having aphasia and set out to find answers to 2 main questions. What factors are associated with and predict psychological distress when people are still in the hospital after a stroke, which is baseline, and at 3 months and 6 months post-stroke, and what baseline factors predict long-term psychological distress after strokes. The results were that what I got from this is that the factors contributing to distress after stroke vary across time, and loneliness and low satisfaction with one's social network are particularly important and contribute to long-term psychological distress. So basically it's a case-to-case basis to understand what we're talking about with psychological distress. The next one I had was Identification of Aphasia Post-Stroke, a review of screening assessment tools. This article was pretty well written and goes into detail about the need for a routine screening test to be able to identify aphasia in a patient post-stroke. Aphasia is one of the most common consequences of stroke, and in early identification, diagnosis, and treatment of language deficits are important steps in maximizing rehabilitation gains. It talks about how it found 6 tools while studying the following searches of the published research literature in strokes. Instruments were reviewed on a basis of reliability, validity, classification, sensitivity, and practical utility. They came to the conclusion that the French Aphasia Screening Test, or the FAST, appears to be the most widely used and thoroughly evaluated tool found within the stroke research literature. This article opened my eyes to new ideas and techniques to better understand how to diagnose aphasia post-stroke and the best ways to do so. This next one I found really interesting, and it was kind of hard to take this one serious at first, but it's can herpes simplex virus encephalitis cause aphasia? This article grabbed my attention right away because of the title. I really was interested to see if herpes simplex virus could in fact cause aphasia. And I learned that the actual virus does a lot of the same things that aphasia does. The virus itself usually affects the frontal and temporal lobes, the subcortical structures, and the hippocampal tissue. The link between aphasia and the HSV encephalitis is investigated pretty thoroughly in this article. Tests showed that in fact the virus did cause learning disabilities and alter them in ways aphasia does. The article itself was extremely interesting, and I'm glad I chose it, because the thing with it was that the actual virus you would never think to cause certain things that aphasia would in somebody, but the longer that they came into it, people had trouble with vision, with language, and it's almost as if they had to relearn the same way you would with a patient that has aphasia. My last one is the quantity of life for people with chronic aphasia. This study is sought to examine the relationships between social activity and aphasia. They had 38 people with chronic aphasia and their closest relative complete a newly developed social network with aphasia profile that they call SNAP, and relatives completed a communicative effectiveness index. During the summer months of the year 2000, they would keep daily records of who they saw, where they saw them, and why they saw them. The main finding of the present study suggests that the severity of communicative disability in people with chronic aphasia is the main predictor of social and community activity, and confirms the importance of communicative skills in the social reintegration of stroke survivors. What they did is they had this test go on for 7 days, where they gave them a certain chart, a certain list, and they had to go every day and, just like it said, where they're going, who they saw, why they saw them, and it provided support for an extension of the amount of therapy typically offered to chronically aphasic people. It also confirms the increased incorporation of psychosocially relevant approaches to speech and language, therapy and rehabilitation, and reablement. Public awareness of aphasia is low compared to other neurological conditions, with similar incidences and prevalence rates. By doing this research, I feel that we're able to help out patients with aphasia, because, as it says, it's not really regarded highly as other diseases or other things diagnosed. So to do this, I think, helps open a lot of windows into the world of communication for people with aphasia, and it gives them a chance to better understand their own world and how to communicate in it. This was basically my presentation. Once again, I apologize for not being here, but I had some stuff I had to take care of. We'll make this seem real. Does anybody have any questions? Yes, Moises?
I'm going to speak for everybody in the class when I say that I found your PowerPoint really interesting. And what made you come up with this idea?
Well, at first I wasn't going to be here because I had something going on in Arizona, but now I have to go take care of some family stuff, and I thought to myself, how can I be here but not be here? Then all of a sudden this light came on in my head, and I was like, alright, I'm making a video. See you later, Dr. P.